Hello, I am Dr. Aseshnanda, cardiologist from Barashat and Calcutta. Today, my topic is our discussion. Topic of discussion is ABPM and its importance. So, ABPM, that is ambulatory BP monitoring, provides a 24-hour account of patient state and is useful for diagnosing primary and secondary hypertension and differentiating it from the white coat and mask subtypes. It is accurate in predicting the risk of cardiovascular disease and mortality. BP level measurements using home and ambulatory BP monitoring is recommended in patients with office BP classified as high normal BP or grade 1 hypertension, that is systolic around 130 to 159 millimeter mercury and or diastolic around 85 to 99 millimeter mercury. ABPM provides the average of BP readings over a definite period of time, usually 24 hours. The device is typically programmed to record BP at 15 to 30 minute interval, and average BP values are usually provided for daytime, nighttime, and 24 hours. A diary of the patient's activities and sleep time can also be recorded. A minimum of 70% usable BP recordings are required for valid report. ABPM values are on an average lower than office BP values, and the diagnostic threshold for hypertension is more than equals to 130/80 millimeter over 24 hours, and 5 more in the daytime average and 10 less for the nighttime average. Better advantages of ABPM are better predictor of hypertension-mediated organ damage than office BP. 24-hour ambulatory BP mean that has been consistently shown to have closer relationship with morbid or fatal events. It is more sensitive predictor than office BP of severe outcomes such as coronary failure or coronary related fatalities and stroke. Can identify white coat and mask hypertension also. Prolonged prognostic evidence is there. Nighttime reading can be taken by ABPM. Measurement is in the real life setting. Additional prognostic BP phenotypes can be detected and abundant information from a single measurement session, including short-term BP variability. And the disadvantages are it is till now a bit expensive in our society. Also, that's why limited availability also is there and can be uncomfortable for the patient at night. ABPM has become an indispensable tool in the diagnosis and management of hypertension and its therapy. Recent guidelines from ESC recommend that diagnosis of hypertension should be based on repeated office BP measurement or ABPM if feasible by the patient. Analysis of various indices of the ABPM graph such as hyperbaric index, diurnal index, dipping and other indices can also provide useful information about prognosis of the disease such as hypertension, diabetes mellitus, CKD and so on. It can also be used to monitor the therapeutic efficacy of the antihypertensive treatment. In addition, ABPM is the single most effective tool to diagnose white coat, mask and nocturnal hypertension and can help direct the treatment in such patients when required. And overall, ABPM readings can guide towards the prognosis of underlying organ damage and is a very useful indicator predictor of cardiovascular risk. So by this, I am finishing today's session. Hope everyone have learned something and enjoyed the session. Thank you and goodbye.